Hey, deserving listeners, couples therapy. Let's check it out.
That she can't diagnose.
It's made her sick.
Yeah.
So it seems to me that he is more in love with his neurotic psychodynamics than he is capable of being loved by a real person.
I hate that. I don't know what she means by that, but there's this really entrenched, stupid-ass notion in our society and in my field that people are addicted to their problems. He's in love with his problem. And Dr. Orna is looking up, which gives me hope that Dr. Orna is like, I don't know about that. It's blaming the victim. It's just saying the client is choosing to be unhappy. And yeah, maybe there are some rare cases where that's true, but it's such a go-to conceptualization for people that have seemingly stubborn, entrenched problems that persist over time. But it's nonsensical and it's victim blaming and it's an easy way out. I've literally never had that conceptualization, mostly because I don't think it's true and it's never panned out to be true, but also because I have other options. I think what happens for people is they run out of options because they haven't had the training, or I don't know, they're not made for this profession and they don't know what else to say. And so they're like, well, the person's addicted to it. And I can't tell you how many times I've heard therapists themselves in a little echo chamber become very convinced of this. You know, one person will say, well, it kind of sounds like the client's addicted to their problems. Yeah, totally. They're addicted to trauma. And I'm just like, eh.
And so that in a couples therapy format where you try to help him get a lot, if he's more lost in his own psychodynamics, it's not going to be meaningful.
And I said this in an earlier episode that most people, including most therapists, would say this isn't made for couple therapy. Couples therapy is contraindicated. I have such a hatred for the word contraindicated because it's almost always used in a way that I disagree with, in a way that basically makes couples therapy out to be like this little nice thing that doesn't have deep thoughts or feelings. It's for like communication where you use I statements and stuff. And it's like couples therapy can't be that, but it can be deeper than anything else you've ever done before. So this notion of just like, oh, you know, he's doomed, you know, and if he were to switch to individual therapy, might that help? Sure. But it doesn't really matter, actually. If I were involved with a couple like this, I could absolutely work with this couple. The couple has a lot of strengths. I've seen much worse than this. He has a lot of self-awareness. I mean, enough. I mean, he needs a lot more, but he has some for sure. I mean, I've seen much worse than that. So there's that. But I would think, well, if I worked with him individually, I could also help him. So it doesn't really matter as a thing. But it's you know, you'll hear me complain when I'm reacting to reality TV where you'll have the friend that will just say like, well, just break up, right? When someone is having trouble in their marriage or something. And it's a way for the listener to avoid they're getting frustrated. They're worrying about their friend. You know, their friend comes to them, it's like, oh, my husband is this and this and that. And then the friend is just like, well, just get a divorce. Or if you have someone come to you and complain about their job, and as a listener, you're like, well, just quit your job. And if you've ever been in an ongoing frustration, you know that people do that, and therapists do it too. Well, just quit your job. We'll just get a divorce. Well, geez, thank you for that. You know, no shit, Sherlock. Really? I can quit a job? I didn't know that existed in the world. Divorce? How do you spell that? Where on the internet can I look up the definition of divorce? I've never heard it. Of course I know about fucking divorce and quitting. If that's all that I needed from you, then I wouldn't have come to you. I know about those things. What I am looking for, at the very least, is someone just to understand and validate. But I'm also, you know, wanting maybe some help about this, you know, especially from a goddamn therapist. So this notion of well, things are going bad. You've bumped up against resistance. Big surprise. And well, you should change venues and just quit couple therapy. Because Dr. Orna, in all likelihood, wouldn't work with either one of them individually, and so they would go to some other therapist individually. And almost never do they say the reverse. I mean, there's so often where you'll have an individual client complaining about their partner, which Boris would absolutely do in individual therapy. almost never do therapists say individual therapy is contraindicated. I don't know if I've ever heard that phrase. Why? Because we are a paternalistic society that is focused on individuals. We're an individualistic society that's focused on separating individuals. You know, when we diagnose people with, medical issues or psychiatric issues, psychological issues, it's always like the individual. And we are, in America anyway, in the United States, we're incapable of thinking systemically and relationally and contextually. Anyway, rant over. I don't even know if that's what the advisor is saying right now. I say advisor because I think that's Showtime's language, and in our world, she'd be called a consultant. I don't think she is Dr. Orna's supervisor. I think she's a consultant.
Yeah. I am rendered absolutely useless to him.
Yeah.
Like, when I try to, like, intervene in a certain way, I can go a little bit, and then he just puts the wall down, and he's like, there's no point in doing that.
Yes. Yes. So I'm not hearing Dr. Orna going along with the notion of quitting the therapy with him, so that's good. But if I were the advisor, I would say, okay, well, what are you missing? It's our job as therapists, if we run up against that wall, to figure it out. Did we think, when I became a therapist, I didn't think that all my clients would be easy peasy, right? And so, yeah, okay, you've run up against a wall. What are you going to do about it? Are you just going to give up? Are you just going to blame the client? It's your job to figure it out. I think Dr. Orna will. She has in the past. And I think they also realize now, the editors of this reality TV show by season 4, that it's good to have narratives, a sort of story arc. And we're halfway through the season, the storyline, I think, of Boris and Jessica. So I'm guessing this is like the belly of the whale.
I really feel like he could bolt. Like, he does not like me. I don't know if he's written me off yet, but I'm in dangerous territory there.
All right, just chiming in here. The rest of this video will be for members of the YouTube channel. So goodbye for now to the non-members. And take care of yourself, because you deserve it. You really, really do.